Hi, everyone. This is Dr. Danaya with Radiant Pelvic Health and Wellness. We are here today with Megan Busk. She is with Utah County Birth Services. She is both a doula and a birth educator, so wears a couple of different hats. So thanks, Megan, for being here.
Thank you for having me. I appreciate it.
So tell me, Megan, you had your first baby in 2015, and that's how you started, getting into the birth world. Can you tell me what turned you having a baby into this calling of being a birth worker and birth educator?
Yeah, thanks for asking. So, I had my first baby in 2015, and it was a really neat experience. My husband and I took a childbirth class, and through the process of discovering what I wanted out of my birth experience, I studied a lot and I read a lot of books and I practiced relaxation and did all of those things. And I just really loved learning about labor, about birth, and it really kind of led me down that path. My birth experience was kind of textbook, that one specifically. I felt all the stages of labor, transition, all of those things. And I was really well supported by my midwife, and I had a doula. My mom was there. My husband was a great birth partner, and it all culminated in this beautiful birth experience. And I felt really called to help other women have beautiful birth experiences as well. And unmedicated labor is sometimes looked down upon in our culture because of TV or whatever it is, different birth experiences that people have heard, but it really can be such a beautiful process. I really was drawn to that. So it wasn't until a few years later that I actually finally took the step and trained and started my journey to become a birth doula.
Yeah, that's awesome. You bring up TV. I think it's funny because you see it on every show. The woman's in labor and she's like holding on to the bed rails or she's like screaming. And if I'm ever with my daughter, I'm like, it doesn't have to be like that.
Yeah.
Like trying
Yes.
to start her young.
Feeding
Like
positive
just making it dramatic.
experiences, positive notes on what labor actually can look like. And it does look like that sometimes. You know what I mean? Like there's such a huge range of what labor can look like. Coming out of that, no matter what it looks like, and feeling that it was a positive experience is huge.
Yeah, I love that. So you are both a doula and a birth worker.
Mhm.
How do those two roles inform each other? And how does that change being in the room to teaching someone before their delivery?
Yeah, I'm a birth doula and childbirth educator, and it really is amazing how they go hand in hand. Like, I'm very passionate about childbirth education. I think that if you are able and you can take a childbirth education class, it's going to make a huge difference in how your labor unfolds, because you have choices and you have options and you have things that you can work on. Um, and sorry, my baby is screaming. I apologize. And so you can really kind of find the experience that you want in all of that. And if you don't know the options, you really don't know what your experience could be like. So I think childbirth education is just so important. And especially as for a woman, I feel like oftentimes women don't know much about their bodies and about what they're going to go through and what that experience is going to look like. And it's super empowering when you can like just know more about yourself and how it's going to transform and give birth to this new human, you know? So I think that is a huge part of it. And then going into the birth space and seeing that all unfold for each woman is so different. I was at two births just last week and they were both completely different, but they were both just so magical. And so every woman, every birth, I've had four babies, every birth is going to be different. So I think they definitely go hand in hand. And then I honestly take back those experiences as being a birth doula and take them into my classes and share experiences that I've seen or that I've been a part of. So it's a really neat relationship between both of those roles that I play.
Yeah. I love that you have had good experiences on both sides because I feel like there's this pendulum in healthcare, right? I see it in PT. We see it with like other things. We've seen it with like birth where everyone had epidurals, hospital birth, and then there was this huge shift of the only way to do it is unmedicated home birth. It can be either, right? Like you said, it can be completely different and it can be great either way. As long as you are getting what you want and making the choice that you want, then you can have a good outcome and it doesn't have to be one way or the other.
Yeah, exactly. And that's is so different for everybody. Like people may want an unmedicated birth or they may want an epidural or a planned C-section or whatever. Like my goal is just to
Yeah.
make sure that whatever that looks like for you and whatever you're wanting, that it's the best experience that it can be.
So there's a quote on your site. It says, labor will hurt, probably a lot, but whether that's negative is another matter. So
Hmm.
that's pretty counterculture to the way that we think about pain. Can you unpack that with me a little bit?
Yeah, I think there's a lot of going around, especially on social media, where it's like you can have a pain-free birth. And while I do feel like some women do experience that, do I feel like every woman is going to experience that? No. Every birth is so different. Going into it thinking this is going to be pain-free is kind of setting yourself up maybe a little bit short, because there often are going to be pains in labor and they can be really intense pains. So the rest of that quote, it says, a laboring woman can be in a great deal of pain, yet feel loved and supported and exhilarated by the creative forces flowing through her body and her ability to meet labor's challenges. And I think that's the powerful part of that quote and why I shared it, because that love and support is huge. And where I come in as a birth doula, being able to be part of that birth team to provide that love and support is a big reason why I do what I do.
Yeah, and me personally, as someone who has given birth multiple times, feeling that power in your body of like, I am delivering this baby, it is pretty amazing, even if it's not super comfortable, right? But it can be an incredible experience.
Yeah,
Yeah.
absolutely.
So you are with women through most of the most physical experience of their life, right? They've delivered this baby, and now they go home to recover. So what is something you wish more moms understood that they needed after birth?
Yeah. And you may have seen over the years, there's been this big push to have 5 days in bed, 5 days near your bed, 5 days on your bed. I can't remember what it is exactly, but basically you're being
Yeah.
taken care of and resting for a full 2 weeks. And we don't see that very often. That's hard to do, especially in our culture, because it's just go, 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 go. I think just being aware of what your body has been through and how important it is to recover from that. And just taking the time needed for your body to heal, and then getting the support that you need after, especially with something that like what you do, being able to provide pelvic floor therapy and all of those things that come along with it. In other places in the world, that's included with their healthcare, right? But in America, it's not, which is a disservice to women everywhere, really, because everyone should be able to have that support prior to having a baby, because it is so important. So just taking care of your body and just loving on your baby and taking those moments together, I think is huge.
So if someone is a first-time mom, they're pregnant right now, they're feeling nervous about labor, what is one mindset shift or birth prep piece of advice that you think would make the biggest difference for them?
Oh, that's a good question. I think it just all goes back to education, honestly, and just being educated. And in along with that, like we talk about, and I've talked to midwives and things like that, if there's like one specific thing you focus on, it's usually breathing and relaxation. And so if you can be working on those things, that's huge. But really, I feel like your experience is going to be better overall when you know what your options are. So yeah, I think that's a big one.
So just taking some sort of birth class that can educate you.
Yes, absolutely. And out of hospital birth classes tend to be more informative. In hospital birth classes don't tend to be as informative, but if you're getting anything, is better than nothing. So I'm just getting off of social media where that information can actually be very different from what you actually need, and sitting down with an educator and actually learning about all the ins and outs of your body, of birth, of all of those things.
So you teach a specific type of birth class. It's called birth boot camp, right?
Yeah, that's correct.
So what do you think? Because there are a lot of different, like you can get different amounts of education, depending on where you go.
Yeah.
What do you think sets that, your type of training, your type of birth class apart from in a hospital one or just another class that you might potentially pick?
Yeah, that's a good question. So it really depends on what you're looking for. I mean, there's very nuanced birth classes where you're getting like hypnosis training or certain aspects of that. We always claim as Birth Boot Camp that we have the most comprehensive class on the market. We do have a 10-week course that goes over everything from the stages of labor to partner support and what that looks like. We practice relaxation and comfort measures. It goes over postpartum and caring for your new baby. So it is a full 10 weeks, 2.5 hours every week. Like, it's a lot of information, which I think is huge. I also teach classes. I teach in Santaquin, Utah, and I currently am teaching our home and birth center class. And so that's very specific to if you're having a home birth or a birth center birth, because it is going to look different than if you're going to be at a hospital and having a hospital birth. But it is just very specific. It's super hands-on, which I think is really fun. So you're not just coming and sitting and listening to me read to you for 2.5 hours. One of my favorites is talking about labor pain and the fear, tension, pain cycle and what that looks like. And we kind of do some activities with that so you can get an idea. We do a lot of comfort measures. So we're up and moving and your partner is supporting you. So when you do get into your birth space, then you are feeling prepared and ready for that.
Sounds amazing. So
Yeah.
where you're teaching a class right now, tell me, where can people find you if they're interested in either booking with you as a doula or as a birth educator?
Yeah, so I have my website. It's utahcountybirthservices.com. You can find me there. I'm also on Instagram and social media platforms, Facebook, TikTok, all of those things. So you can find me any of those places, but my website is probably the best option.
Okay, amazing. So I've got one last question for you, Megan. It's 2026. You've been doing this for quite a while now. Tell me, what is the thing that keeps you coming back to this space that you just love about your job?
Yeah, I was actually thinking about that the other day because I was on call for two of my clients and it was a little bit stressful. I was like, they were both texting me at the same time, like, I'm 2.5, 70% of face. I'm like, you guys cannot have your babies on the same day. I will be so sad. And it was kind of stressful being on call. But once I got into the birth space, I'm like, this is why I do this, because it is just so beautiful. And being able to be part of that process with these amazing, powerful women and seeing how they are taking birth and making it their own. It's just really incredible. And then on the other side of that, being a childbirth educator, I didn't realize how much I would love it, but I started teaching and meeting these couples and just having so much fun talking with them about all this crazy stuff I know in my head about, about birth. So I just love it. It's so beautiful to me, and I just love being part of it.
Well, thank you so much. Thanks for sharing with me and with everyone just about your journey and about the things that you do. I really appreciate it, Megan.
Yeah, thank you for having me. I appreciate it. It's been wonderful.